Why is it called a boner if there is no bone? Did we used to have bones in it? A great question. No bones in a human boner. Can a man test positive on a pregnancy test? In a pinch, ants actually can be used as stitches? And is smashing your boob during this health procedure medically necessary? Today, we're diving into some of the strangest, most unhinged medical questions pulled straight from Discord and the depths of the internet. All right, let's dive right in, shall we? Is it true if a man took a pregnancy test, it would always show up positive? And why is that? So first off, no. The pregnancy test is testing for a hormone. It's called the HCG, or the human chorionic gonadotropin hormone. Will go up in pregnancy, and we test it typically first trimester to see as it goes up. It should be doubling every 48 hours. Could a male get a positive result? Could, in certain rare circumstances. It should be followed up because there are some tumors that will secrete HCG, germ cell tumors, that you'd want to get evaluated and double check that you don't have, or if you do have it, obviously get treatment for it. Odd question. In a pinch, if I were left out in the wild without a hospital, can you actually stitch a wound with ants? Yes. So you would need ants with big, strong mandibles, and so you would need to actually have that mandible grab on each side of the wound and be able to pinch it and bite it closed. And at that point, then you need to actually twist the body off of the head and the mandible so it stays in place and almost like collapsed down. So that is great. It can help close the wound, but the issue ends up being infection risk because you're out in the wild, the wilderness, and you're probably not cleaning the wound as best you can. Plus, you're pinching through dirty skin as well. I would say this is probably your last resort. Why do they literally smash your boob during a mammogram? Is that actually necessary? So unfortunately, the answer is yes. So the mammogram is a low-dose x-ray that squishes breast tissue between two plates to spread out the breast tissue to hopefully detect early abnormalities within the breast tissue itself. It can detect tumors, cancer, calcifications, or dense breast tissue that might need further evaluation. It's a relatively low radiation exposure screening tool to help catch early breast cancer. Anybody out there ever have a mammogram? Let me know what your experience was like. I get terrible, crippling anxiety. Would it be worth getting a lobotomy, or do they still do those? No, don't do a lobotomy, and no, they don't do them. So a lobotomy is basically when you sever the connections of your frontal lobe. This was done in like the 1930s into the 1950s. There's movies about this. It's an old surgical procedure, typically when they would actually go through the skull, right near the eye, go into the frontal lobe and sever some connections. If you're an individual that is struggling with anxiety, there are other modern therapies out there. There's therapy, there's medication, there's neuromodulation like TMS. So there are options out there that can help. Can oral probiotics or mouthwash change your risk of oral STIs, or totally unrelated? If we're resorting to using Listerine, we have a problem. Probably not. Maybe there's a slight improvement, maybe because of the alcohol or whatnot, but it's not typically at high enough concentrations to really significantly affect the bacteria that causes these type of infections or reliably prevent STIs. So mouthwash, STIs, what are you thinking? We're thinking herpes, we're thinking chlamydia. Use good judgment, safe practices. If somebody has symptoms of infection, please don't interact with another individual and expose them. Is it true babies in the womb are fish until they are born? That is a great question and super cool about our anatomy inside the womb. So they kind of are, because the babies in the womb live in a fluid environment like fish and sea creatures do, but they don't use their lungs. They're not breathing the air. They don't need to. The blood is actually coming in oxygenated from the umbilical cord. The mother breathes in oxygen, gets into the blood, goes from the blood to the placenta to the umbilical cord to the baby, all while the baby is inside the body, not breathing any air. Very cool and very amazing. Why do you see stars when you get hit in the head? It has to do with your retina being mechanically stimulated. So that jolt causes a misfiring of the retinal cells to do these stars or flashes of lights, and then it calms down. So it goes back to normal, typically okay. But if you have repeated head injuries, then it could fire a little bit more frequently, and then you do get concerned when you're having head pain relating to the concussion. Is it now related to your brain versus just the eyes themselves? So it should get evaluated. Even myself, I've had multiple concussions while I was in college, getting head injuries, elbow and knee to the head. Definitely got a concussion, saw stars for a long time. Now, don't really see stars. Every now and then it'll happen where you're like, whoa, flashes of light. Sometimes intense, sometimes not too bad. I tend to have a lot of nightmares, to be honest, and I drink a lot of apple juice. Are there certain foods that can trigger nightmares more than others? Yes, especially heavy, spicy, sugary foods, especially before going to bed. It can basically interrupt sleep, get you excitable, cause reflux, have sleep interruptions. All of these things can interrupt sleep, which then can also make your dreams more vivid. Some other foods to think about, like chocolate, alcohol. These things can also cause sleep disturbances, which then can increase the risk of more vivid and emotional type dreams, especially even nightmares. Apple juice has a lot of sugar. That's why for me, I will have an apple while I am working because it's a healthy source of sugar. Is it possible to amputate limbs and give artificial limbs to stroke patients if they can't walk otherwise? The answer is no, because it's not the limb that's the problem. The limb is fine. It's got blood flow, it's got the nerves, everything is intact and functioning. It's the brain tissue not telling the limb to work and function and getting the signal to it and back from it. Because the stroke is a brain injury. It's not a leg injury, it's a brain injury. So typically the only way to really fix a stroke, if you show up to the hospital within 3 to 4 hours, the sooner the better, we can actually give you medication to try to dissolve that clot, get blood flowing back to that area of the brain, and save that function of that area of the brain so it continues to work. Does using cocaine when you're young cause schizophrenia? Had a friend do a lot of it when we were younger, and now he has full-blown schizophrenia. Cocaine is a stimulant, increases blood flow, heart rate, blood pressure. It's an illegal substance. It has been potentially shown to, further down the road, induce psychosis, which then continued drug-induced psychosis can lead to schizophrenia. We see this with many different kinds of illegal substances, not just cocaine, but a lot of times it's also for an individual that might be more at risk of developing psychosis due to potential family situations, risk factors, genetics, those sorts of things. Cocaine and these other substances produce or release a surge of dopamine in the brain. And so a lot of the psychiatric illnesses have to do with the dopamine dysregulation. Why is it called a boner if there is no bone? Did we used to have bones in it? Great question. No bones in a human boner, but there are bones in other species boners. So maybe that's where it derived from, made up of just tissue, the corpus spongiosum, as well as the corpus cavernosum. Those are the fancy tissues that make up said boner. Is the food pyramid outdated? And did it mess up an entire generation? It is outdated. The original food pyramid was based on like the industries of the time, agriculture of the time, what was available. So that's what really drove the food pyramid. In modern times, we found that a balanced diet of like proteins, vegetables, fats, certain carbohydrates are really important, but also metabolically flexible diets. So meaning to be able to use all of these foods as fuel and nutrition for our bodies. So what's a medical question you've always been curious about? It can be embarrassing, it can be really serious, it can be something that you're just curious about. Let me know in the comments. I'd be happy to answer. I love answering questions. This is what I do at work when patients ask me questions anyway. If you guys enjoyed this, definitely check out this playlist right here. Lots of educational videos in this playlist. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.